Hello and welcome to the very first podcast episode that we're producing for the What the Frack substack. I'm Heidi Leithwood. I'm a climate policy analyst with 350 Colorado, and just a little disclaimer before we get started, I am not a podcaster. I'm coming to this work because I'm a concerned mom and I want to do everything that I can to make the world a cleaner and better place with a stable climate for my children and grandchildren. I work for 350 Colorado. We are a nonprofit statewide organization, and we were founded a bit over 10 years ago to work on solving the root causes of the climate crisis and move us more quickly to a sustainable future. What the Frack substack is a collaboration between many environmental groups that are working on standing up and fighting against the harms that fracking causes. So just to give you a little context about fracking is a fairly recent, within the last 20 years, a technique for taking oil and gas out of the ground, in which a solution of water and chemicals and other substances are pumped into the ground at really high pressure to try to break up the rock and extract oil and gas. And many Coloradans don't realize that there are tens of thousands of active oil and gas wells producing, and thousands more right now being drilled and fracked, and that many of those wells are in our communities and coming into our communities, drilling near homes and schools and drilling for miles underneath neighborhoods. This is why we're here today, to discuss the health risks of fracking. Many of us know that fossil fuels, the burning of fossil fuels, is one of the main causes of climate change, and it's also one of the main causes of air pollution worldwide that kills 1 in 6 people. But what many people don't know is that just the act of taking it out of the ground is also an extremely high polluter. In Colorado, it's the number one cause of greenhouse gas emissions, also the number one contributor of emitting chemicals that cause ozone, and there are also many other toxic chemicals. And that's why we're here today, to look at the health risks of living nearby fracking wells. And I'm super excited to have our guest with us today, Dr. Lisa McKenzie, who has done some groundbreaking research on health risks of fracking, and specifically in Colorado. And Dr. McKenzie she has a PhD in environmental chemistry, she has a master's in epidemiology, and she, for many years, was professor at the Colorado School of Public Health at Anschutz. Recently retired a few months ago, but as you can see, she's still dedicated to continuing her work to try to protect people. And so welcome, Lisa, and thank you so much for being with us today. We really appreciate you.
Well, thank you, Heidi, for that introduction, and I'm just very pleased to be here today. Thank you.
And would it be safe to say that you've dedicated a great deal of your career to studying the health risks of fracking?
It would be fair to say I've dedicated my entire career in public health, which started about 2009, to the health effects of fracking.
Okay. Yeah, it would be great to hear more of your personal story and how you got into studying the health effects of fracking.
So my public health career and being a professor at the Anschutz campus was actually a second career for me. So I'd been doing environmental consulting for many years, and then I went back to school to get a master's of public health. And when I did that, I learned about a project that's Roxana Witter, who was a professor at the school at that time, was working on over in Garfield County in Battlement Mesa. The Battlement Mesa, there was a big plan to put quite a few wells. I think it was about 10 well pads into Battlement Mesa, and they were going to do a health impact assessment for that. And they asked me to be on that team because I had quite a bit of experience in environmental chemistry. That's what my PhD is in. And I also was getting my master's in epidemiology at that time. So putting those two things together put me in a unique position to really look at the health effects that might be occurring around fracking. And then what really piqued my interest was on a plane flight over Garfield County, just a commercial flight. I can't remember where I was going, but heading west. I looked out the window and I saw the over the 7,000 wells in Garfield County at that time. And what I thought to myself was, well, oh my gosh, that's 7,000 point sources of benzene. And benzene's a known human carcinogen.
Right, yeah. And is that what led you to your interest in researching leukemia?
That did prompt my research in childhood cancers, yes, as I learned more about how high some of the benzene emissions were and how they were accumulating in these areas, particularly over in Garfield County at that time.
Right, and that must have been a shock flying over and seeing all of those wells and just kind of having that aha moment.
Yeah, well, it really puts it into perspective when you can just out across the landscape, all you could see was just one well pad after the other. It was just a checkerboard of well sites.
Oh, yeah. And I know that in Weld County, there are over 30,000 active wells in Weld County, which is one of the highest producing counties. So just imagining that for our listeners, if listeners wanted to see a map of all of those wells, you can go to the ECMC website, and all of those little red dots, when they're that dense, they just merge together, and it just looks like it's one solid oil and gas production site, the entire county. So before we get into your actual studies, it would be really great for our listeners to try to understand how studies are done. So could you sort of give a study design 101, like how do we set up a good study?
For rare diseases like cancer, particularly childhood cancers, which fortunately are rare, they're devastating, but they're rare, is you do a case control study so you can get enough statistical power in your study. So what you do there is you take, within a given area and time period, you take all the children that have cancer, particular cancer you're looking at, or adults if you're looking at adults, and then you take within that same population a certain number of people that don't have cancer, so your controls. And then you look back in their histories to see what their exposures were. And so then you compare the rates of cancer, or the rates of exposure in your controls and in your cases. And if you see higher relationships in your cases or your children with cancer than in your controls, then you assume there's an association.
Thank you. Yeah, and the control subjects are to show that there's a difference between people that didn't have the exposure and people that you can show did have the exposure. Is that correct?
No, the controls are to show that people, well, that's somewhat right, but we usually think about it a little bit differently. So the controls you're showing in the controls that they have a lower rate of exposure than the cases. So some of your controls may have been exposed, but maybe they didn't get cancer. So it's okay. It's not everyone that's exposed is going to get cancer, and it's not everyone that's not exposed isn't going to get cancer, because there's other causes of cancer. So you're just looking at the difference in rates between the two.
Okay, so the subjects did get cancer, and then the controls didn't get cancer, and then
the cases have cancer, and the controls do not have cancer. Correct.
Thank you. Sorry for
I might have to go back
making me dumb it down. Just
so
want
the
to make
cases
sure
have
we
cancer,
understand.
the controls don't have cancer, and you compare the exposures between those two groups. And if the case have higher exposures and the controls have lower exposures, then you assume there's an association between the exposure and the cancer.
That makes sense.
Okay.
Yes, thank you. Okay. And so this kind of brings us to your most recent study. Would you like to tell us a little bit about this more recent study on childhood leukemia?
Yes, so in this more recent study, it did have a more rigorous design. We used that first study, which was to somewhat hypothesis generating. We call it a preliminary study, and we saw potential associations there, so we did the second study. And what we did is we looked at, we took all children born in Colorado between, I think it was 1992 and 2019, and we looked in those children, and we selected all the children that had been diagnosed with a childhood leukemia. And then the other children born that didn't have childhood leukemia, and we made sure didn't have another cancer, we chose our controls out of that set of children. So for every child that had leukemia, we chose, I believe it was 5 or 6 controls, and matched them to that child based on the birth date, the birth year. And I think we also matched on ethnicity, Hispanic ethnicity. So
the controls were similar to the cases.
Yes, so everyone had been born in Colorado between these years, and all of these children had been registered in Colorado's birth registry. So it was the same population from which we were drawing our cases and controls, and that's really important to do to avoid some confounding.
Right. And as I was doing my homework, I think what I understood was that for this study also, you were able to have an extremely sophisticated method of determining how intense the oil and gas activity was that they may have been exposed to. Is that correct?
For the new study, we used what we call an intensity-adjusted inverse distance weight. So in addition to just looking at the distance of that well pad from the home, we looked at what was going on the well pad for every month of the relevant exposure period for that given child. And so we looked at whether the well was being drilled or it was in completions or production. We looked at the number of wells on the well pad. We looked at the production of oil or gas from the well pad, and we made adjustments for intensity based on that. And then we also used data that's been collected more recently on emissions from oil and gas pads, like how much are the benzene emissions during different phases of oil and gas production, and adjusted for that. We also adjusted for the timing. So if it was developed, let's say in 2002, when they could still have open pits and uncontrolled flowback, then we gave it a higher rating, a higher intensity than if it was more current, when we have more of the pollution control or green completions on the wells.
So let me see if I understand this correctly.
Okay.
In the first study, you looked at how far the wells were away from people and how many wells there were that they were close to and how far they were. But in the second study, you were looking more detailed at what kind of emissions, what the phase of production was, so that you knew how much benzene they were probably being exposed to.
So this well was likely to have this more benzene than this well. And also we also looked at what phase they were in Colorado regulations. So were green completions becoming standard practice, or was it before green completions were becoming practice, for example, common practice?
So that is super detailed and just capturing all the possible variables. And the conclusions were that the cases who did have childhood leukemia were more likely to live near oil and gas activity. Is that correct?
Yes, they were more likely not only to live near oil, but to live near the most intense oil and gas activity.
Right. That makes sense from a common sense perspective, and I'm just so grateful to you for doing all of this rigorous work to be able to show that scientifically. And it seems to make a lot of sense that regulators should look at how dense an area is already before they decide to add yet more wells to an area. Is that
that is what I would recommend, as well as what other sources of pollution there are in the area in addition to oil and gas development. Oil and gas is a major emitter of several pollutants in Colorado, but they're not the only source of pollutants in Colorado, and so that's important to keep in mind.
Right.
So you need to account for everything that's going on in the neighborhood. Also, from that study, I want to add, we saw from that study that just thinking about how far one well is from a home or the closest well to a home, it's not as simple as that. You have to look at the totality of what's going on.
Right. And that's definitely, from a policy perspective, that's definitely what we would like to see them doing and basing their decisions on that more.
Yeah, so.
I did have another really simplistic question. So if you found that the people that did have the childhood leukemia were more likely to live near a high-density oil and gas activity, and the more dense it was, the more likely it was that they lived there. Can we flip that around, and would you say that people that do live near high-density oil and gas activity are more likely to get leukemia?
I would put that a little differently. I would say they're at a higher risk. I wouldn't. It's hard to flip that language around in the case control study design. But the closest I would come would be to say that the children living near the sites are at a higher risk of it. I wouldn't say that they're more likely at this point. That's a stronger term than I would use.
Right, yeah. And I know that scientists always want to make sure that you can really back this up with the science. But it sounds like you're also saying that this level of risk is enough that we need to use the precautionary principle and protect people that live nearby by protecting against that risk with stronger regulations.
Yes, I would say that, not only from this study, but from some other recent studies that have been done, as well as studies in Pennsylvania are having very similar results. These are studies that were also done on the same leukemia we looked at, and they also saw higher risks for children living near the oil and gas wells. So as you start to see more consistent findings across different studies, that also gives in environmental epidemiology, it gives more certainty to results. I'll just add, in environmental epidemiology, we can't do that randomized controlled trial, which is like the gold standard for an epidemiology study, because we can't put people into experimental groups.
Right, you can't put them purposely into something that might be dangerous.
Exactly.
Yeah, that makes a lot of sense. And I know that your studies have also touched on symptoms that people living close to oil and gas wells have reported, like upper respiratory problems, nausea and vomiting, and nosebleeds. And then you've also looked at studies about increased risk for heart problems, birth defects, low birth weight, and I think other impacts. Is there anything more that you can tell us just across the board of all of the impacts that you've studied, and then we'll delve more into some specifics?
So across the board, from the studies we've done here in Colorado as well as other states, it appears that the health risks from oil and gas development seem to really be most pronounced in the very young, so young children and unborn children, and possibly in the elderly as well, so more susceptible groups. And so that's something of concern when you start seeing your more susceptible groups having higher risks.
Right. And the study we were just talking about, you also looked at exposure in the womb. Is that correct?
In the study you just talked about with the heart defects, yes. So that was a study we did where we looked at exposures during pregnancy and the likelihood of a child having a congenital heart defect.
Oh, right. And in the study on the childhood leukemia, were you also looking at where the mother lived when they were pregnant?
Yes, we looked at pregnancy as well.
Yeah. And another study that you were a co-author on, I noticed, was a study that Dr. Megan Weisner, I think, was I don't know what the terminology is, but the lead researcher on that, or? She was
the lead researcher on that. So at that time, Dr. Weisner was the epidemiologist for Broomfield and Broomfield Public Health.
Right. And I was doing my homework this morning, and just what struck me was that she was looking at the fact that health risks from both ozone and volatile organic compounds together were going to be higher than if you just looked at them separately. Is that somewhere in the ballpark?
And so I thought you were talking about a different study. So yes, this one actually was done when Dr. Weisner, where she still is, was at the Environmental Defense Fund.
Okay.
So she had moved on to another position. And so yes, so what they were doing in that study, which was really groundbreaking for risk assessment, is they brought in ground level ozone. Ozone down here is bad and ozone up there is good.
Yeah.
Right? Because we want the ozone to absorb the ultraviolet radiation that's before it gets down to us.
Yeah.
Down here, it has a lot of health effects, including respiratory effects and cardiovascular effects as well.
Yeah, and I think people get confused about that all the
Yeah.
time. I know when I moved to Colorado and saw the signs, high ozone day, I didn't know ozone was a health risk.
Yeah.
I just remembered we were trying to put it back up high in the atmosphere to protect us from the sun. So,
Right.
but it does have some really, really serious impacts, and we are in a severe, an area that's been designated as severely out of compliance with EPA health guidelines, right?
Yes, we're outside so ozone is one of 6 chemicals or substances that are regulated at the federal level in the air under the Clean Air Act.
Mm-hmm.
And so we're out of compliance with those federal standards for ozone.
Yeah. And in this study that came out this year, the study looked at the health risks if you combine the ozone and with all the volatile organic compounds that are emitted, and to look at the combined risk. Is that correct?
Yes, that's what they were doing. And
I noticed that it also showed that these risks were higher and there was a lot more pollution during the drilling and during the fracking periods more than in the production.
Mm-hmm. That's true.
So it seems like it would help our ozone problem if they didn't do that drilling and fracking in the severe ozone area during that season.
Yeah, so that's a recommendation we did make in that study. And it also showed where the health risks were really elevated for the acute risks, so short-term,
yeah.
Health risks.
Right.
And then they also saw some elevated cancer risks as well, but that that was not due to the ozone. That was driven by the hazardous air pollutants.
The hazardous air
benzene.
pollutants.
Yeah.
But I was super interested to see the scientific finding that these emissions are much higher during those pre-production activities.
Yeah. So, or the health risks are much higher.
Health risks.
Yeah.
Right.
Yeah.
Thank you. Keeping an eye on the time, we have a ton of topics to cover, and we could probably talk about this for hours, but a couple of other recent studies that you've done that have come out after the Colorado regulators have beefed up their rules after our new law, SB 181. But you've done a couple studies since then, and one was on the atrial fibrillation, and one was in the Broomfield area. Is that right?
Yes. So the one on atrial fibrillation, that was a study we did using the Colorado's all-payer claims database. And so basically that includes all insurance claims made in Colorado for people that are insured in Colorado. So it doesn't include people that aren't insured. It represents about 70% of Colorado's population. And what we looked at in there is we took people in there that had a diagnosis of atrial fibrillation, which is a arrhythmia in the heart. And this mostly affects older people. So by the time people are 80, about 10% of the population has this condition. It does affect younger people, but the incidence is much lower in younger people. And what we wanted to see were people that were living near oil and gas sites, and particularly multi-well pads, so the big sites. Mm-hmm. Did they have a worsening of their atrial fibrillation condition during the development phases of oil and gas. So when they're drilling and doing the fracking and the completions. And what we did is we compared the same person before the well pad went in, during that time of developing the well pad, and then in production. So we were following the same people over these phases of production. And what we found was that people that were living nearest to the well, and we also, I should add, we followed people, the same design, that were living 2 miles away from any well pad. So we had a comparison, because there's other things that can be going on. Once again, you know, there's seasonal things that are happening. There could be a large wildland fire that's also affecting the air that would be concurrent. So we wanted to follow people that weren't near the well pads as well. And what we found is that people that were living closer to the well pads did have an increase in what we were calling exacerbations of atrial fibrillation during the development of the well. And that fell off after the development period was done. We didn't see it in production. That was most pronounced in the most elderly people, so people older than 80 years of age, and more pronounced in women.
Yeah, I remember that from the study, that like all women had a slightly higher risk of it, but over a certain age had an even much more extreme increased
of their condition and
exacerbation.
And we don't, from the design, we just looked at their proximity during the time, so we don't know if it was air pollution or if it was just stress. There's also a lot of noise that happens during particularly the production or development of the site, and that can increase stress levels or impact sleep, which could also all impact atrial fibrillation.
Right, so it's more of that could be an indirect effect of it, but it's a real effect.
It's a real
but we
effect,
don't know if it was coming from the pollution or from the terrible stress of all the vibrations and the noise.
Noise is also pollution. So noise pollution or chemical pollution.
Would you say that the vibration is a pollution?
I would. Noise is a type of vibration, so
True.
And it's and then there's the vibration some people have reported feeling in the earth. I don't know if that's actually been measured, that the noise has been measured, but but there's a lot of anecdotes of people talking about feeling the well pad, right, and then in the Broomfield study, these were self-reported symptoms. Oh, before I forget, though, I want to go back to the recent leukemia study where you actually found that this increased risk up to about 8 miles
away.
13 kilometers, which is about 8 miles. So basically what we were seeing in that study, which was interesting, and this is why I'm going back to, it's not just about one well, is we saw that children living, when we looked at the children that were in the different levels of intensity of oil and gas development, we looked at each of those groups to see where the closest well was. And for the middle intensity, so where we saw increased risk, it wasn't the highest exposed group, we saw those children could live up to 13 kilometers. The nearest well could be 13 kilometers from their home. So the way I've been trying to visualize this a little bit is, if you think of, there's a home on, they don't see any oil and gas wells, but kind of off in the distance, there's really high intensity of oil and gas development going on. So those children were seeing increased risk. And those children, the highest group, their nearest well was within 5 kilometers, or about 3.2 miles, or about 3.2 miles from there, or 3.1 miles from their house. So those were bigger distances than have been reported before for risk. But we also saw that children that only had like one single well, even if it was like within a mile of their house, or 2,000 feet from their house, may not be at increased risk.
If it's one single well.
One single well.
Right. And just for listener context here, some of these new well pads, they might have 1 or 2 vertical wells, but dozens of wells underneath the ground drilled out horizontally under neighborhoods.
Yeah.
So it's getting more and more intense.
Right. And the pads often anymore have, 20, 40 wells on a pad.
Yeah.
Even sometimes more.
Yeah.
So, and then the horizontal drilling allows them to do that.
Right. Yeah. And for the listener, they drill down vertically and then they change direction and they go horizontally underground, sometimes for up to 5 miles, or is it more than that?
I had heard 2, but maybe it's more than that now.
I think their technology is continuing to improve so that they can grab more and more of that oil and gas. Okay. So there's so many other studies that you've done, and we're going to put links to the studies on the podcast show notes. And also, we have thank you so much for working with me on the author-approved summaries of some of the studies. I want to get up to date and get the new ones in there too. But if we could just, do you have any other takeaways from the other additional studies beyond these ones we've gone into depth?
Yeah, so you mentioned one other, which was in Broomfield as well. And that one, Dr. Weisner also led, and that's when she was the epidemiologist in Broomfield. And so in that study, we looked at self-reported symptoms, and we looked at people that were, I believe, living within about a mile of their well pads, and we were just looking at people in Broomfield County, so they had to be a resident of Broomfield County. And then we also looked at people that were living more than 2 miles away from the well pads in Broomfield County. And what we saw was that people that were more concerned about air pollution and water pollution and environmental exposures in general reported more symptoms, like respiratory symptoms, nosebleeds, nausea, coughs, if they were living nearest to the wells, than people that were also concerned about air pollution and water pollution, environmental concerns, that were living further away from the wells. And people that reported that they were not concerned about any of the environmental pollution, so it was just the opposite effect. They reported fewer symptoms. So we're not sure what was going on there. We don't know if we don't know what was happening. So, but we saw a large increase in symptom reporting in people that were concerned about environmental concerns if they lived near a well than if they lived further away. And we saw decreased symptoms in people that weren't concerned about environmental pollutants that lived near wells than lived further away.
So if they weren't concerned, they had more symptoms when they lived further away and less symptoms when they lived closer?
Yes, or we
somewhat. That is fascinating.
Yeah.
That as a non-scientist and just a lay person, I might bring up the word denial there.
It could be. It's a very political issue, and people participating. So this is what I think we had some participant bias probably going on, and how they were reporting things. And it could be that people that were concerned about the oil and gas wells were much more likely to be reporting symptoms, and people that actually thought there was no problem with them maybe didn't want to report this, or just didn't notice things. So we just don't know what happened there, but that's what we saw.
Very interesting. Yeah. But those kind of symptoms have been studied elsewhere too as well, right? And documented?
Yes, we chose those symptoms based on other studies done in mainly Pennsylvania and the Marcellus Shale, other areas there.
Yeah. So are there additional things that you would like to see studied? I know that I've seen research or read about research about endocrine disruptions from fracking fluids.
There's been some research on that. I think that's been more laboratory-based studies where they've taken samples of water and they've looked at organisms that have been can't remember what they exposed to those and looked at what happened, or cells. Also looked at some in vitro cell studies. But what I'd actually like to see happen, if we had all the money in the world and all the time in the world and all the will to do it, and we still feel like we need more information to say that there's an association, is I'd like to know more about what specifically around oil and gas might be associated with these health outcomes. Is it the noise? Is it the increase in benzene levels? Is there something we haven't measured that's there? We've said benzene. We know it's a carcinogen, but it's kind of like looking for your keys under the lamppost, right? We know about benzene, but we don't know about all the stuff out there in the shadows that may or may not be there. So like I said, if I had all the time in the world and all the money in the world and, all the resources needed, it would be ideal to go into an area before they start drilling a big well pad, take noise samples, take air samples, and enroll a cohort of people that you can follow. Take take blood samples where you can measure some of the markers of inflammation. Also take blood pressures, heart rates, do some measures of sleep, and there might be some other things you want to look at, and then follow them over the course of the development of the well pad and into production, and periodically be taking the measures of exposure, so air pollution and noise pollution, and continue with the health measures that you're measuring and see if they change from before development of the period through the development of the well pad or not.
That would be really cool.
And that would be a prospective cohort study, which are hard to do because they take a long time, so you have to follow people for a while. I mean, we're talking about probably a 5-year study, and you also and you have to have a lot of people enrolled, and so for those two reasons, it is one of the more expensive studies to do.
And this would be sort of related to what you brought up earlier, I think, where there's certain studies that you can't do because you can't purposely put people in danger and find out what happens to them. But these are people that are going to be exposed to this anyway, and there's no stopping it because the permits have already been given. And so you would just follow them, take measurements before and follow them throughout the process and see what happens to them.
Right.
Well, I hope somebody does have the time and money to be able to run a study like that.
Yeah. The other thing that's been suggested but never got off the ground was to set up a health registry for people living near the sites where they could have their health symptoms and different outcomes recorded. Would that be like self-reported symptoms, or would there be? It could be self-reported symptoms, or it could be there could be a clinic that would collect information from them that would not be, that would be more objective data. Once again, that's a fairly expensive design because that has to be done for a long period of time, and to really see any signal you have to have, tens of thousands of people and something like that, I think, possibly, but.
Well, as a community member and somebody who works with community members, we find ourselves saying all the time, well, look at all these studies. People need to be protected, and what's going on? Why aren't they listening? And the types of new studies you're suggesting would, maybe pound people over the head with, yes, this is happening. But we're seeing that it looks like there's enough of your research to point to the need for better protections. And I know that you've really been engaged with trying to work on policy too.
Yeah, so I was on a panel in California where we were of public health experts, where we were advising a similar government group in California that regulates their oil and gas development. And while on that, some of us got together and wrote a paper about applying the hierarchy of controls to oil and gas development. Nicole Diesel from Yale was the lead author on that, and then I was the second author.
Yeah, I was just reading that again yesterday.
And so that is, thinking about just not one thing that you need to do, but so what we're recommending there is looking at the setback distances. So how looking at how much oil and gas development, and then also looking at the emission controls, and that's emission to water, emission to air, and really having stringent emission control strategies and making sure they're working. So so there has to be the enforcement side of this. I think we've seen in Colorado a few times when there's a pretty good regulation in place, but if it's not enforced, it doesn't work.
Yeah, for sure. So. And I know that we have set these bigger setbacks in Colorado, but there's a lot of off ramps, and one of them that drives me crazy is the substantially equivalent protections. And so, yeah, that really gets me. If there is a greater risk known and proved by a lot of studies beyond yours, but in other places, and how could there be a substantially equivalent protection that would make it safe for someone to be closer than 2,000 feet?
Well, the only thing I can think of is that they're putting on some sort of engineering control or emission control where they're having a zero emission type of thing. But if you're not monitoring to make sure that works, it needs to be reliable if you're going to do that. You need to know it's working, and when it's not working, you need to stop.
Right, and these controls, I think they call them best management practices, and I think that's a number of your studies have been done after they already set these more stringent best management practices, and then you're still finding the risks. Is that right?
And best management practices aren't regulations. Best management practices are best management practices within the industry. So they're industry standards that individual operators can decide to use or not. It's different than a regulation. So that's important to keep in mind. And if an operator is coming in and promising certain best management practices, they need to be held to those. They're not just, they sometimes, I think, are seen as suggestions.
That's a really, really good point, because if the commission is looking at requiring best management practices, but then they're not actually saying what those practices should be, or
best management practices vary from operator to operator.
Yeah. Well, with that hierarchy of controls article, I did notice that the number one way of protecting people would be to simply stop drilling new wells and then plug up all the old wells. That stuck out to me because that's exactly what we're trying to do here. We produce way more than the energy that we use in Colorado, and yet our communities are getting polluted. I also noticed that the paper said the engineering controls stop it at the source for like local things, but they might not necessarily protect against regional things like ozone or global things like climate change.
Right.
Did I get that right?
I think when you think about the setback distances, so those protect a local population. So let's say we went and put all our oil and gas development over 10 miles away or 20 miles away from where anyone lives. We're still having contributions to ozone, regional ozone, and climate change.
Yeah.
So it doesn't help with that.
Right.
Yeah. And I do think the statement about, the most protective thing to do is, when it comes to oil and gas, is just to stop extracting oil and gas and leave it in the ground and shut in and remediate the existing wells. But I think of it as almost like an addiction. And if you just, a heroin addiction, for example, or even an alcohol addiction, if you just stop cold turkey, there might be some rather bad outcomes from that as well. Doesn't mean you shouldn't try to get there, but it has to be thought about very carefully.
Definitely.
I think, that's what I'm trying to say.
But the fact is that globally, there's twice as much production already planned as more than we need, twice as much as we actually need. And so if we were to stop giving new permits for oil and gas in Colorado tomorrow, that doesn't mean everybody has to stop using it tomorrow. It means that gradually the wells would run dry, and we are like ramping up renewables and stuff like that. So it wouldn't be like a cold turkey thing.
Yeah, that's a way to be thinking about it a little bit more. And as we, the renewable energies has come a long ways, and anecdotally, this isn't where my research is, but it's globally it's come a long ways. And I think ultimately likely what's going to happen, or what I guess I hope happens, is, really the market drives a lot. And as the renewables become more and more feasible and more cost effective, they will outcompete the others. I mean,
I think that we saw a good announcement about that from the UN Secretary General recently. I was going to ask you about like the accidents, like beyond just the risk of normal activities. There have been a couple of really big accidents. You probably heard about the Gailton well blowout, and then a couple years ago there was a different older well that had been plugged back in 1993 that all of a sudden erupted with a green geyser.
So these catastrophic events that have happened on the well pads, and they do happen from time to time. I think of these as rare events, but when they do happen, they have a pretty high risk with them, and they have high risk for what we call the big S safety stuff, right? So, people actually being burned, and particularly for the workers, but also for nearby residents, particularly if you have one of these particularly a large facility within 500 feet of your home or 2,000 feet of your home. When you see that blown out, you can think of all the air pollutants that are coming up with that, and all the land around that's now contaminated with whatever spewed out of the well. So that's a catastrophic event, and there is that risk from it. There was a paper written on it. I wasn't involved in this study. I think Hallie was the first author on that. You might want to check on that one.
Okay. I'll check on that.
That was probably published about 10 years ago. So
a study on big catastrophic events?
Yeah, looking at, so kind of applying some of the fire codes to distance between homes that they would have for a refinery or something like that.
Okay, that sounds good. I'll check that out for sure. And we're getting to the end of our time, but I would love to just hear what you're looking forward to in your retirement. It looks like you're continuing to do some of this work.
I'm doing a little bit of this work. I am doing a little bit of consulting. I'm still working with the Environmental Defense Fund on some of the risk assessment and in Broomfield, and doing a little bit of work with New Mexico. And other than that, I'm just I'm enjoying my family and spending time with my family, and pursuing some of the other interests in my life, some of my fiber art interest. And
are you a weaver?
I spin and knit. So
nice.
Doing that, and just and then getting out in the outdoors, which I always love to do. I love to hike and cross country ski, so just more time for some of those pursuits.
That sounds really great, and wish you the best in your retirement, that it just brings you a lot of enjoyment. And thank you so much for all of your work over the years, and for being here with us today, and just everything that you've been doing to try to protect people from harms.
Well, thank you, Heidi, and thank you to what you're doing and what 350 Colorado is doing around education around climate change.
Thank you. And then I'll just give a little goodbye to our listeners, and just to say 350 Colorado, if you'd like to get involved with us and, like me, push yourself a bit out of your comfort zone because you really care about the climate, visit us at 350colorado.org. I also want to say a huge thank you to our videographer today, Dan Van Note of Van Note Videos. And a big thank you to Denver Community Media, which we're using their wonderful podcast studio here today. And then for ongoing information on what's happening with fracking in our state, you could visit or subscribe to the Substack What the Frack, and that's that collaborative Substack that we will be posting this podcast on. And visit our YouTube channel also for potentially more podcast episodes. Hopefully this isn't just a one-off podcast episode. We have a bonus short containing our complete discussion on scientific study design, available at What the Frack Substack or the 350 Colorado YouTube channel. Music is by Savage Resistance. You heard a clip of the song Regenerate from the album This Is How. It's available on Spotify, YouTube, and other streaming services. Thank you so much to Andrea Savage for donating the use of her music. Thank you to Mark Billings for editing, Allie W. for creating the graphics for the video version, and Earthworks for the photo of a fracking site near homes, which appears in the video version and in the show notes. If you would like to sign on to a support letter for phasing out new fracking well permits, visit Safe and Healthy Colorado website. That's safeandhealthyco.org.